I want to dig deeper and bring in Kinsa founder and CEO Inder Singh. Inder, your company tries to stop the spread by using more immediate data. You beat the CDC repeatedly. How? Why? Conventional wisdom would tell you that CDC has the fastest, best data. How'd you get it?
The logic is really simple. If you can speak to millions of households in real time when they first fall ill and ask them questions about how they're feeling, what symptoms they have, well, you're going to be ahead of the healthcare system. Because by the time the healthcare system sees a case of COVID or flu, it's too late. The transmission has occurred days or weeks earlier. And that's what we're doing. We've got these illness response apps that coach people, parents, when they first fall ill. It asks you a series of questions, and we help you understand what to do, how sick you are, and what's going around your local area.
How do
when you zoom out and look at millions of households, you can now see trends. You can see trends about where unusual transmission is occurring. You can see trends where there's severe symptoms. And that's how we're getting ahead of the healthcare system to say, hey, there's an unusual outbreak here. It looks like cold, or looks like COVID, or it looks like a stomach bug. Send the virologists in, send the test kits in, respond here.
How do you find these millions of people? I know you did this in New York City. You did it in Palm Beach County. I got sick with COVID. My whole family did. You and I didn't connect.
Well, you can purchase one of our smart thermometers. I'm not sure if you can see this properly here in retail. We also give away our illness guidance apps and smart thermometers through this wonderful school program. It's free for schools. Staff and parents can get a free Kinsa illness response system, the smart thermometer and the app. And there's all these features that come along with that particular school program, like you get to see the level of illness at the school or in your child's grade. And programs like that are proven to work. In one study, we showed a 27% decrease in illness-based absenteeism in that school program. So that's how we're reaching the masses. We've been doing this for 6 or 7 years now. And this is the kind of technology that our public health institutions, that CDC needs to be using. Again, the science and logic is really simple. If you can talk to people when they first fall ill, well before they're sick enough to go see a doctor or enter a lab, you have an opportunity to characterize that illness and get ahead of it. And I go back to the question I posed when I first started Kinsa. How do you stop an outbreak before it becomes an epidemic if you don't know where and when symptoms are starting? Okay. And the answer, as we all know, is you don't.
Everything you're saying, I'm buying what you are selling. Why isn't the CDC? Because you've got the technology. You now need access to the mass population, and the CDC isn't working with you. Why aren't they?
We've briefed the CDC many, many times over the last 5 years. I recently had a conversation with senior officials at the CDC and said, hey, look at the data. As a reminder, as early as 2017, we predicted the worst flu season on record 2.5 months ahead of everyone else. How do we collaborate? And the answer I got back was, we don't really work with the private sector. We don't really work with technology startups. You should work with the CDC Foundation. And I got to tell you, that was extremely disappointing. This is the first time I'm speaking out about this particular situation. It struck me in my head. I kept thinking to myself, wait a second, the science and the logic are clear. It makes sense. Why are we not working together? It's because you don't want to work with the private sector, and you're punting me to the CDC Foundation. So I did my homework. I went and talked to other private sector CEOs, much larger companies. Remember, the CDC has received billions of dollars for things ranging from early warning to genomic sequencing. And I heard a consistent story, which is that they aren't really collaborating with the private sector. Listen, you tell me, but the days of innovation being done in a government lab, that was the 1970s. That was 50 years ago. Innovation today is being done by technology companies, by startups in the private sector. And the idea of the CDC is such a brilliant one, an institution that's going to help our country respond to disease. But there needs to be better collaboration across communities and with the private sector if we're really going to get ahead of this. I was aghast because we've lived through a pandemic and there's still not a willingness to embrace new technologies. If you want to rebuild the wheel, it's going to take the CDC decades. And this is the time that we need to be collaborating. It's doing the country a disservice by not creating those collaborations across the private sector and the CDC. And we need to nip that in the bud. and really accelerate things. We don't have the time. And I think we're going to talk about it in a moment, but there's a multi-demic coming right now. There's a multi-demic coming this season.
Inder, you are right. We do not have time. We don't have any more time right now. But please come back soon. We did just live through a pandemic. We died through it, too. And it is time to work together to solve for this. Inder Singh, thank you for joining me today. Please come back soon.